I thank my colleagues for joining me on a topic that means so much to us, to the rest of America, and frankly to every American family, and that is making sure that America pays its debts. Of course, everyone thinks about the fiscal implications for the federal government, but we're here to talk about this as an economic nightmare.
Many people will start receiving new checks soon. Some states have already proposed issuing new tax credits that will provide eligible households with thousands of dollars in extra money. The IRS has already released important news on this, and now even the governor has announced his 2-year budget deal to propose for the Connecticut Earned Income Tax Credit. This is a huge, big issue in Congress right now, and hopefully they can get something done by the end of this year. During a press conference, everybody, the governor told reporters that there are people who work every day, sometimes working double jobs doing what they can do to get by. So the Connecticut Earned Income Tax Credit is a refundable state income tax credit for the low income, working individuals and families that mirrors the federal Earned Income Tax Credit, increasing the rate to 40%. It would make 40% Connecticut among the top 5 states in the United States with the largest tax credit rates. The highest tax refund is for the working poor in Maryland. Even the commissioner has stated it encourages people to work. It encourages people to stay healthy and make ends meet. And that's a good thing. Also, folks, don't forget about this. The governor's office said that the current rate of 30.5%, a married family with 2 qualifying children receives a state credit of up to $1,800. If the rate were only 40%, the same family would receive a state tax credit of up to $2,500. An additional $585, people get everything they want. Even the state Senate president said that they may not have state income tax liability because their incomes are often so low that they are not at the liability when it kicks in, but they are in fact taxpayers. This refundable credit makes life more livable for those struggling every day. The proposal is part of a 2-year budget proposal. Whether it is permanent or has bipartisan support is debatable. The proposal was estimated to cost the state nearly $45 million annually. That's a lot of money that can go down the drain. But a new slew of crisis-era subsidies, including tax breaks and even this, subsidies, everybody, is the threshold for the claiming a child tax credit. Now, a tax bracket and standard deduction for 2022 has been inflation adjusted, meaning that the changes are nominal. There are several changes that could impact taxpayer liabilities for the year, and many U.S. state taxpayers receive their third stimulus benefit of $1,400.
Recognized. Mr. Speaker, I rise today in strong opposition to House Resolution 382 and urge my colleagues to support my motion to recommit, which would prohibit this legislation from going into effect as it will negatively impact Medicare beneficiaries. Speaker McCarthy has publicly stated that cuts to Medicare will be off the table in any debt ceiling negotiations, but that commitment clearly does not carry over to today's legislation. House Resolution 382 would increase patient costs and cut hospital payments to Medicare beneficiaries. In its nearly 68 years of existence, Medicare has given millions of Americans access to affordable health care coverage. Generations have been given peace of mind knowing that they'll have comprehensive available coverage to them of any age, regardless of the financial status. In 2021, nearly 64 million Americans, including 4.8 million Floridians, were enrolled in Medicare. These individuals are Democrats, Republicans, and everything in between. They're our friends, our family members, our colleagues, our neighbors, our mentors. We must ensure that these beneficiaries can continue to rely on the life-saving coverage provided through Medicare. The President has announced his intention to end the public health emergency on May 11th, providing a glide path to smoothly transition out of...
Next up is Senator Thune.
Thank you, Mr. Chairman. Welcome to both of you. It's good to have you here. Dr. Haffajee, congratulations on your nomination, and thanks for your service at HHS to date. I believe this was covered in your staff interview, but I want to be sure to bring it up on the record. As policymakers, we are evaluating long-term telehealth policies for when the public health emergency is over. It would be helpful for the agency to be able to provide Congress data on utilization trends, including by modality, such as audio-visual and audio only, as is currently permitted now. Is this something that HHS could commit to doing if you're confirmed?
The House of Representatives is finally voting on new legislation, everybody. This bill will affect millions of you guys that are on Social Security benefits, and also if you are a senior citizen. A $1,000 monthly benefit increase is going to be approved this month, so watch until the end to learn how to receive it. Social Security crossed a new milestone, everybody, when it reached its 87th anniversary on Sunday. The program was first signed into law by President Roosevelt, and today it provides monthly checks to more than 65 million people. Now in 2035, according to the program's trustees report, just 80% of benefits will be payable. The House Democrats John Larson of Connecticut and Pramila Jayapal of Washington teamed up this week to call to bring a bill to expand Social Security up for a vote this fall. That proposal, called Social Security 2100, would expand benefits, which hasn't been done in a very long time. Representative Larson told reporters it's long overdue. They will make sure that we're enhancing a program that they need, especially during this time, to be sure benefits are adjusted for inflation with annual cost of living adjustments, while a wage index method of computing benefits was introduced in the late 1970s. But advocates for expanding Social Security argue that benefits have diminished over time. According to an analysis by the Senior Citizens League, Social Security benefits have lost 40% of their buying power since the year 2000. Jayapal, who serves as the chair of the Progressive Caucus, urged action as soon as next month. Jayapal said, when Congress returns from recess this September, we need to bring this bill up in committee and then send it to the floor for a vote. The latest Social Security 2100 bill, put forward by Larson, seeks to enhance Social Security benefits in multiple ways. It calls for increasing all checks by about 2% of the average benefit. At the same time, it would also set the minimum benefit above the poverty line and tighten to current levels. The measure for the annual cost of living adjustment would be changed with the goal of better keeping up with the costs retirees faced. The bill also calls for providing caregiver credits to people who take time out of the workforce to care for children and other family members. Benefits for students would be extended to age 26, and children who live with grandparents or other relatives would have also increased access to benefits. The bill calls for ending the 5-month waiting period for disability benefits folks in order to pay for the benefit increases. And also, currently wages of up to $147,000 are taxed for Social Security in 2022. Employees and employers each pay a 6.2% tax on wages for a total of 12.4%. Social Security 2100, a sacred trust, currently has 202 Democratic co-sponsors in the House of Representatives. It is one of the several Democratic proposals that aim to tackle Social Security reform. But one key difference is how long they would extend the program's solvency. And the Social Security 2100 Act would extend the depletion date to 2038 from the current projected date of 2035.
Thank you for the important question, Senator Thune. Telehealth has been so important during the pandemic. We've really learned so much already, but need to continue these evaluations as well. ASPE has done a fair amount of work on telehealth utilization across payers, across populations, and some by modality, as much as we can identify that, and shown,